that I know that many of my members and colleagues have in the opposition side. But I think one of the biggest challenges for me to accept is the fact that the government is purposefully starving the healthcare system by taking and diverting highly qualified and trained nurses and other allied health professionals
purposefully starving the healthcare system by taking and diverting.
We already know that there's already a significant shortage of highly trained professionals, healthcare professionals who are passionately working in our healthcare system. Operating rooms are now sitting dark, which is quite hard to imagine given the crisis that's before us, because they actually lack nurses. They don't have enough staff in those facilities to keep those facilities going. Surgical procedures and backlog are an all-time high. And we know that the hospital beds that the government likes to brag about, and certainly there might be something worth boasting about, they're not very good if there's no nurses to attend to them. So there's a lack of nurses, there's empty hospital beds, there's dark OR rooms, surgical procedures and diagnosis are taking longer and they're being delayed and oftentimes canceled because of a shortage of lab technicians. Ontarians are already receiving less care and are waiting longer because of the decisions that this government has made, decisions that include not investing in staffing, not investing in retention, and certainly not paying them to the wages that they deserve. At the same time, if you recall, Speaker, the government spoke to them often and called them heroes, and we all did that. If you want to roll back the clock, 2020, there was a lot of fanfare made about their healthcare professionals. We were banging our pots and pans on our balconies, on our porches. We were applauding them everywhere. I know there's certainly a lot of burnt out healthcare workers that told me firsthand that they really appreciated that love and support. Now they're saying to me, what happened to that love and support? Where did all that go? These are the same healthcare workers that actually carried us through the darkest days of the pandemic. They were the same ones that ushered our loved ones out of facilities as they had passed, while they're trying to give them the high quality dignity of care that they deserved, and all of this under the worst and most horrible working conditions. You can't expect good results when you're denying healthcare workers and nurses the dignity of good pay, respect, and reasonable workloads, as well as fair working conditions. If you cap their wages and disregard their unions, take them to court over your unconstitutional Bill 124, that level of disdain for the workers is just really quite staggering. And what's worse is that most of those workers are women, and oftentimes racialized women. I certainly do understand when an exhausted, burnt-out nurse is going to take a job at a private clinic because they have to make those difficult decisions to go get the wages that they need in order for them to care for their family. What I don't understand, and I absolutely reject, is that this government is actively creating the conditions and even encouraging for-profit, two-tier healthcare system in our province and deliberately scooping out those highly qualified and trained nurses out of our hospitals. You have the tools, you have the money to make the healthcare system work. Public hospitals in Ontario are already world-class, but that's going to quickly spiral into a rapid decline until you reverse course. The only reason I can think of why this government is so hell-bent on wanting the public system to fail is because they're setting up the system for two-tier privatized American-style healthcare. And we have learned that there's 45 million Americans that have gone bankrupt because of high private healthcare costs. The rich will get faster care, they're going to get perhaps better care, but what's worse is that everybody else will have to wait and their suffering will be prolonged. But newsflash, as I have mentioned, that the American-style two-tier healthcare system doesn't work. Studies and reports, time and time again, have pointed to the fact that it becomes more expensive, it's more bureaucratic, there's more prone to fraud, it's more fragmented, and many a times it has been governments have had to reverse course. Now, I want to be able to share with you why it's so absolutely critical for us on the opposition side, why we're so passionate about protecting our public healthcare system. Now, one of the things that I really want to press upon today, Speaker, is the fact that this bill has an absolute lack of regard to the patient's well-being and safety. Public for-profit surgical centers must be connected to a public hospital with an emergency room in case there are complications during the procedures that require intense patient care, adding a specialist on the fly so that they can get in there very quickly to help save lives and to provide support. This makes good common sense. It's generally best practice. It keeps people alive, Speaker. So you can understand why I'm surprised when I read this bill that the independent health facilities, quote unquote, are no longer required to be connected to hospitals, Speaker. What is the government's plan when an emergency goes wrong and complications emerge, which inevitably it will? What happens when there is a mass scramble and struggle to save that patient's life on the table and there's no one to connect them to? There is no ability, Speaker, to be able to sort of magically produce an emergency room to a hospital attached to it at that point in time, because you've actually decoupled it. You've made it worse. And complications, Speaker, can happen to just anyone. Imagine if your loved one is forced to have surgery. Nobody wants to go and have surgery. It's an unpleasant procedure. Now, you may be seeking out-of-pocket expenses because you're forced to go to a private clinic. You may be going there because of long public wait times because the government has starved the public system of the high-quality nurses that they need to run the facilities. How would you feel if that was your family member? What this bill is doing is actually shameful and wrong. Why is this government not set out in prioritizing the delivery of publicly funded, high-quality health care for all Ontarians? Why are they leaving up so much to be determined later on? There is some vague language about a yet-to-be-named oversight body to make sure that the system runs well. Well, that sounds fine, except for we need to dig deeper. How are you going to regulate a private system when you have no details in the bill right now? And the regulations are to be determined later on, and you want us to just trust you that you've got this? Well, Speaker, forgive me, but I don't trust this process. I certainly don't trust the intentions of the government because they haven't earned it, given all their actions to move to the privatization of healthcare. We want to be able to keep Ontarians healthy, Speaker. It's absolutely critical for us as parliamentarians to do everything we can to protect our residents. But what I know about healthcare facilities, and especially if you're sort of leaving them unchecked with no strong regulatory body with enforcement afterwards, is that these healthcare private facilities, as we have seen in the U.S., will engage in something called cream skimming. And they will select the healthiest, least risky patients who are then the cheapest to operate on to pocket that extra cash. Everybody else who doesn't have an American Express Gold card in their pocket will have to get in the back of the line. That is not fair, Madam Speaker. It is actually, I would even argue, un-Canadian. This two-tier healthcare system is created merely to propagate and to create profits for the existence of these new private clinics. And we're seeing them, Speaker, even though the bill hasn't passed. They are already emerging in Ontario. Now, the system will also ensure that those who have more complications, who require more complex surgery, will be sitting in the public line that has been starved by the government. These private healthcare facilities will select their wealthiest patients who have the ability to pay for all the extras, the little bells and whistles. The bill will try to mitigate this, but it doesn't go far enough, as oftentimes these government bills don't, is that it's so vague. It speaks to it, but there's nothing that actually enforces it. And as we know, Speaker, regulations and laws without actual enforcement is useless. Speaker, the private clinics may make optional changes, which they would seem unavoidable, and they will upsell patients. We're already hearing about those stories. I know I am, Speaker, and it continues to flood into my office. There is nothing to prevent the private clinics from only choosing to work with the tools and the procedural styles that they want to, which means those that are not covered by OHIP. So for example, Speaker, this is a very common example. Some vein surgeries have two options: a minimally invasive glue-based method that is faster and that does not require anesthesia, and there's no downtime for recovery, and it is not OHIP covered. Simple. There's also another procedure that is generally requiring full anesthesia, and it is more invasive and more painful. And would you think that the private clinic is going to offer them the publicly funded system, or are they going to ask them to pay for it out of pocket? And the pressure will be there, as I know that as it will be, because it's already being reported. Higher quality equipment that facilitates better outcomes should not be hidden away in private clinics for the wealthy. They should be studied and, if appropriate, funded and put into our public system. And this is why there has to be clearer rules and consequences for private clinics, Speaker, because there's a lot of misleading information that's put forward, and it also includes billing practices. And under the new system that the government is proposing, we are going to see higher pressure for upselling, and that there's going to be there's going to be much more vagueness on what the true cost will be until afterwards. I'd like to think that we can force these clinics to publish their eligibility and rejection criteria. Wouldn't that be nice, Speaker, if they're going to be funded by our private dollars going into for-profit coffers? We should know who are they accepting as patients or who are they rejecting, so we know who these clinics are going to truly serve. And yet, Speaker, I'm very confident that the government's not going to even introduce an amendment such as that, something that will ensure greater accountability on where our public tax dollars are going to go. I think Ontarian speakers has the right to know who these facilities are serving and who this government is investing in. This legislation does not lay out the requirements for the continuity of care or do anything to address the horrendous family doctor shortage in the province. Patients undergoing surgery need to be followed up by a family doctor, oftentimes for advice, for care after the surgery. Even if a patient already has a family doctor, which is good for them, but there's no clear outline on how the communication is to be managed between this for-profit clinic, Speaker, and the family doctor. There is no integration of the broader healthcare system. I'm concerned that patients will get lost in the system, as we are already seeing, Speaker, because of the incredible shortage of staff, despite the fact that these individuals will need rehabilitative supports or perhaps after surgery critical care. This bill does not indicate where the patients will go, oftentimes after their surgery. They will be left on their own. And so even if the surgical procedure is successful, if an individual patient does not receive the necessary aftercare because of surgery, they could fall back into illness. And so, Speaker, there is really so much in this bill that is so wrong. And unfortunately, I got to keep going because I'm going to talk about the other things that are wrong with this bill. Now, I want to be able to talk a little bit about innovation, because this government has talked about how it likes to innovate and the fact that they're moving things forward in a technologically advanced way, and that how everybody else in this House seems to be a Luddite. Well, let's talk about innovation for a little bit. This bill misses an opportunity that is so easy and simple for the government to pick up, and that is to establish a centralized specialist referral system. It's an easy fix, Speaker. It touches on data-driven technology that can actually place the surgical wait lists and the wait times and the specialists into an open environment that is accessible to the referring doctor, to the patients who are looking for that information, and even to the healthcare worker. Last week in this House, I asked a very simple question about the government potentially proposing to the government that they create a centralized wait list data bank, something that the BC government that has done, placed it onto their website. We can all go look at it right now, and we can see how many days, how many weeks, or how many months, if it's a really complicated surgery, is that person and the patient in the queue for. Patients, with the advice of their doctor, should be able to choose who is the specialist that they want to see, because everybody should be given some choices. However, it needs to be open and transparent. The Ontario Medical Association has said that a centralized waitlist could cut the times by 20 to 30%. And I want to reiterate that, Speaker, 20 or 30% reduction of wait times just by making the data publicly available. How about that? Such a simple, elegant innovation to healthcare provision that's already being done in other jurisdictions in Canada. Our current system has been described by doctors as sort of looking through a pinhole. What they're telling you is that they don't really see the full picture, and so oftentimes the specialists that they're referring to, they really don't always know what's going to happen on the other end because the information is not open, Speaker, and not transparently shared. British Columbia has already implemented the system that I've just described, and they've seen an 11% drop in the number of patients who've been waiting more than 6 months for knee and hip replacements. Saskatchewan ran a program like this for 4 years that covered all surgical procedures, and their numbers were spectacular. I thought there was a mistake in the printout. And they saw an 89% reduction, Speaker, in the number of patients waiting for 3 months and longer for surgery. Talk about innovation. Talk about bringing better healthcare to Ontarians. The Canadian Association of General Surgeons has shared that most of their membership is on board for a centralized waitlist, but they need the government to come to the table to run it and to maintain the infrastructure. Why is something so simple, so elegant, so proven as best practice to deliver better results not in this bill? I don't think it's a very big ask, especially considering the big win that will be available for the patients because they know and have access to better quality information, as well as those who are referring them to those services. Big wins like this are absolutely impossible if the operating room, Speaker, is dark due to the lack of staff. And if we don't have allied health professionals qualified and ready to go to actually make sure that the healthcare system works, then of course you're not going to be able to get those big wins. So it's so much easier to say, well, we're going to create innovation by contracting it out, by making it public funds accessible for private profiteers out there. And so while there is this odd doublespeak, Speaker, and I struggle with it, because the conditions of creating a high-quality, world-class healthcare system are here. The money is in this province. The coffers show us that the dollars are there, and yet the government has steadfast devotion to racing to the bottom, to contracting out, to upholding Bill 124, even though it's been deemed unconstitutional, by demonizing the nurses and the healthcare professionals and the union workers, has just been really, Speaker, I can't tell you, it's setting us in the wrong course. It's going backwards. And I think, Speaker, Ontarians want us to do better. Ontarians are expecting the parliamentarians in this House to actually fix the healthcare problems that we have. They want this government to keep their promise when the Premier said that he was going to get rid of hallway medicine. And instead, for 5 years, Speaker, things have gotten consistently worse and much more expensive with no help in sight. So this bill cannot be supported. And yes, if we have to say no, these are just some of the reasons why, because no one believes that this bill is going to fix the healthcare system and end the problems that are plaguing our healthcare professionals. They don't believe that this government is going to deliver the solutions that they need today in Ontario. Thank you.
Thank you. Questions? Point of order, member from Brampton North.
Just rising on a point of order to welcome some friends to the legislature. We have